जी बिस्मिल्लाहिर्रहमानिर्रहीम। ओके गाइस, बैक टू द पाथवेज। ठीक है, हमने कहा कि हमने इनविटेशंस कितनी उम्र में सेंड करने हैं, 24.5 ईयर्स की एज में। ठीक है, विद दोज टू दोज हु आर रजिस्टर्ड एज फीमेल्स। एंड फिर जो है वो स्क्रीनिंग शुरू होगी 25 से 50 और 50 से 65, 25 से 50 एवरी 3 ईयरली और 50 से 65 एवरी 5 ईयर। यहाँ तक हमें बात समझ आ गई थी। उसके बाद ना अच्छा बच्चे इस बात को मिक्स कर देते हैं कि 25 टू 50 ईयरली है, 50 टू 65 5 ईयरली। देखिए शुरू में गैप कम है, ठीक है, फिर बाद में गैप 5 ईयरली ज़्यादा हो जाएगा 50 ईयर्स के बाद। सही है। अच्छा अच्छा मैं ना इंग्लिश में बोलती हूँ ताकि ना ज़्यादा लोग ये वीडियो देखें। सो बेसिकली नाउ वी हैव टू कैरी आउट द HPV टेस्टिंग इन द स्क्रीनिंग, राइट? एंड what method of taking the sample do we use? Do we use pap smear or cytobrush? These days we use liquid cytology or cytobrush. Okay, now if HPV is positive, what are you going to do? If HPV is positive, then in that case you are going to do out a cervical cytology test. And if cytology is negative, then this means it is positive negative, that HPV is positive and cytology is negative. Then in that case you are going to give a another chance. You're going to ask the patient to come back in 1 year, rescreen in 12 months. And again, after that patient comes in 12 months, you're going to again do the HPV testing. And again in this case, if HPV is positive or negative, if it is still positive, then you're again going to do out the cytology. And the cytology, let's say the result remains same, right? The cytology is negative, then in this case you are again going to give her a second chance. ये बहुत बड़ी बात है। हम एक चांस देते हैं लोगों को, हमने उसको सेकेंड चांस दिया कि नहीं 1 साल और तुम बाद दोबारा आओ, तो हम उसकी 1 ईयर, क्योंकि साइटोलॉजी तो नॉर्मल है ना, तो हम उसकी 1 ईयर बाद दोबारा स्क्रीनिंग करेंगे ना। अब जो सेकेंड रिकॉल है ना, अब जो सेकेंड रिकॉल है इस पर भी अगर HPV पॉजिटिव आता है, मतलब सेम रिजल्ट रहता है, then in that case we are going to, or do positive आता है, then in that case we are again going to carry out a cervical cytology test, और regardless of the result of this cytology test we are going to do a colposcopy, क्योंकि अब बहुत हो गया। तो हमने इसको कितनी दफ़ा रिकॉल किया? हमने इसको पहली दफ़ा रिकॉल किया। जब पहली दफ़ा इसका HPV, अब ये वो सिचुएशन है जब HPV पॉजिटिव है लेकिन साइटोलॉजी नेगेटिव है। ठीक है, अगर साइटोलॉजी पॉजिटिव हुई किसी पॉइंट पे भी, मतलब पॉजिटिव मतलब अगर अब नॉर्मल हुई, तो हम उसी वक्त जो है वो उसकी कॉल्पोस्कोपी कर लेंगे। फिर मैं उर्दू में बोलना शुरू किया। ओके गाइस, सो वी आर गोइंग टू री-स्क्रीन हर इन 12 months if her HPV is positive with a normal cytology. And if she comes after 12 months and again she have the same results, then we're again re-screen her in her 12 months. And now if she comes after her second recall and she has the same result, now we're going to do her colposcopy, because we are not going to ask her for a third recall. Okay, बस याद रखना कि थर्ड रिकॉल नहीं करना, राइट? बिकॉज अब कंजेक्यूटिव HPV 3 साल तक पॉजिटिव आ गया ना, एक को आपके पास आई पहले साल, फिर आपने उसे 1 साल बाद दोबारा बुलाया तो दूसरे साल हो गया, फिर आपने उसे 1 साल बाद दोबारा बुलाया तो तीसरे साल हो गया। तो 3 consecutive years her HPV has been positive with a negative cytology, so there can be something wrong. So now we're going to do a colposcopy. So please remember that in this normal algorithm you are not going to go for a third recall, but you are going to go for 2 recalls. Every recall is going to be 12 monthly. Okay, now we get it. Okay, now we're going to talk about the colposcopy results. Okay, so let's say that the कॉल्पोस्कोपी हैज़ बीन डन। ठीक है, अब हम पहले सिन पढ़ लेते हैं, बाद में हम बाकी चीज़ें पढ़ेंगे। कॉल्पोस्कोपी आपने कर ली और उसमें ना आपके पास आ गया सिन। ठीक है, अब सर्वाइकल इंट्राइपेथिया नियोप्लेजिया, नाउ इट कैन बी 1, इट कैन बी 2, 3 और इट कैन बी सर्वाइकल ग्लैंडुलर नियोप्लेजिया CGN। ठीक है, तो उसको हमने इस हिसाब से जो है वो क्लासीफाई किया। इसको याद करने का बहुत अच्छा तरीका है दैट इफ़ इट इज़ sin 1 then you have to remember 1236. If it is sin 2, sin 3, then you're going to remember 636. And if it is CGN, then you're going to remember 6 1236. What is the meaning of 1236? कॉल्पोस्कोपी पे आपने फ़ौरन उसे ट्रीट नहीं कर देना। ठीक है, कॉल्पोस्कोपी पे sin 1 आया है, आपने उसे 1 ईयर बाद रिकॉल करना, मतलब 12 months बाद। ठीक है, रिकॉल करना, रिकॉल आपने उसे किया और आपने उसका स्क्रीनिंग किया, HPV पॉजिटिव आ गया। ठीक है, वालेकुम अस्सलाम। Okay, so in खुल गई OPD? अच्छा मैम. So in SIN 1, we're going to recall her in 12 months and we're going to do her cervical screening. If HPV is positive, then in this case, we're going to go out for a cytology. And if cytology is negative, then we're going to recall in 12 months. And if this is the same protocol that we were using in the simple screening, right? But if the cytology, if the HPV is negative, then now we're going to recall her after 36 months because there's no issue. HPV is negative, so we are not supposed to be concerned about anything, right? So this is why we call it 1236. Is everything is normal, right? If HPV is negative on her 12-month recall, then we're going to recall her on her 36 months, and then we're going to do that again. But if on her 12-month recall her HPV is positive, then we're going to do a cytology. If cytology is also abnormal, then we're going to go for colposcopy. But if cytology is normal, then in that case we are going to go for again recall in her in 12 months. Now here's the catch, this is the problem, this is where we all get confused. Okay, the first recall in this case is going to be in 12 months, but in a normal screening the second recall was in 12 months, but in this case the second recall is in 36 months if cytology is negative. So it's not 12 over here. Our second recall was in 12 months. We saw that in our normal cytology, right? We were going to go for two recalls and we were not going to go for a third recall. Instead of a third recall, we were going to go for colposcopy. But over here, we are going to go for a second recall, but that is going to be, delayed after 36 months because cytology is negative and it's already diagnosed as SIN 1. Okay, now we're gonna quickly talk about SIN 2 and SIN 3. So its formula is 636. We're gonna recall her in 6 months after for the test of cure because we have given treatment. What treatment we have given, we will discuss that later. Now we're gonna go for a test of cure. We're gonna recall her in 6 months, and then if her HPV is negative, then we're gonna recall her in 36 months. Okay, but if her HPV is positive, then regardless of her cytology, we're gonna go for colposcopy because this is SIN 2-3. This is not something that is normal. Okay, SIN 2-3, we have to be very careful. Now in case of CGIN, we're gonna go for a test of cure in 6 months, then we're gonna recall her in 12 months, then we're gonna recall her in 36 months if everything remains normal. What happens if HPV becomes positive? In any of these recalls, we're gonna discuss it later.